I've always meant to come into a rural community like Fort Smith and being able to provide the quality that they should be able to receive in New York, California, or any of those other places I trained. So I came here with a purpose to become a part of the community, provide the best quality of care possible, and without having to travel outside or without having to worry about making it a 2-hour drive, getting EMS to take you there, being transferred, and potentially having a worse outcome because of the delay in care they get. And here at Fort Smith, you will be able to get that care with me. I became involved in robotics during my residency, and obviously I have good training in my bariatric surgery during my fellowship. And what ended up happening was that I married those two together. What I'm trying to provide is kind of first an Arkansas experience for being able to do bariatric surgery with the Da Vinci robot. And this will allow me to do more complex surgeries, a standardized procedure, and hopefully provide better care for all of my patients. As a bariatric surgeon dealing with obesity as an actual disease, what I was able to see that the surgeries that I offered and also the medical management was able to change people's lives drastically. Some of the changes I noticed were that obviously having lost the weight, they felt more comfortable as a person themselves. The other thing is I've treated multiple medical conditions. I've had people come off their blood pressure medications, their diabetes medications, and the life changes that they have are drastic. Some of the people have been able to have get out of bed easier, been able to exercise, even just enjoy the small things like walking the dogs that they previously couldn't before. And on top of that, they also don't have to be tied to having to measure their sugars every day, having to have that constant knee pain that prevents them from standing at work, having long shifts. Those are all things that are just what you can see even on the surface of that. What you don't see on the surface is just longer quality of life. Overall, not being obese allows them to live longer and have a healthier lifestyle in general. Once you become my patient, it's going to be a lifelong experience. We're going to be working with you before surgery extensively for several months. What I'll be providing is education. You need to be educated to take care of yourself. So we'll be working on diet, vitamins, what kind of exercise you should do, how much protein you should take in, and then kind of understanding what kind of changes your body will be going through. And once we have that education, it's different for everyone, the length of it. But once that's done and you undergo surgery, what's most important is following up with me. I'll be taking care of you lifelong. You'll become a part of my patient and my care.